Guillain-Barré syndrome, or GBS, is a rare but serious autoimmune disorder that can have a significant impact on a person's life. It primarily affects the peripheral nervous system, which is responsible for connecting your brain and spinal cord to the rest of your body, including your limbs and organs. In GBS, the body's immune system mistakenly attacks the myelin sheath, the protective covering of nerve cells, which is crucial for proper nerve signal transmission. This immune attack disrupts nerve signals, leading to symptoms such as muscle weakness, tingling sensations, and in severe cases, paralysis that can affect the entire body. GBS can affect people of all ages, though it is slightly more common in adults and males. It does not discriminate based on age or gender. While the exact cause of GBS remains unknown, it is often triggered by an infection, such as a respiratory or gastrointestinal infection, which precedes the onset of symptoms. The good news is that most people recover from GBS with proper treatment, which may include therapies like physical rehabilitation and medications to manage symptoms. Early diagnosis and treatment are crucial for better outcomes, as they can help prevent complications and speed up the recovery process. Knowing the signs and seeking immediate medical attention is vital. Early intervention can make a significant difference in the prognosis and overall recovery. Imagine the myelin sheath as the insulation around an electrical wire. This protective layer ensures that electrical signals are transmitted smoothly and efficiently along the nerve fibers. When this insulation is damaged, the electrical signals can't travel efficiently. This disruption can lead to a breakdown in communication between the brain and the rest of the body. This is what happens in GBS, or Guillain-Barré syndrome. The immune system mistakenly attacks the myelin sheath, disrupting the transmission of nerve impulses. This leads to a variety of neurological symptoms which can be quite debilitating. These symptoms typically start in the extremities, such as the hands and feet, then progress towards the trunk. This ascending paralysis is a hallmark of GBS. This progression can happen rapidly, sometimes within hours or days, making it a medical emergency that requires prompt attention. Understanding the mechanism of GBS helps us appreciate the importance of early diagnosis and treatment. Early intervention can significantly improve outcomes and reduce the risk of long-term complications. The exact cause of GBS remains unknown. However, research suggests that it is often triggered by an infection. The most commonly associated infection is Campylobacter jejuni, a bacterium that causes food poisoning. Other infections linked to GBS include cytomegalovirus, Epstein-Barr virus, and Zika virus. In some cases, surgery, vaccination, or trauma may also trigger GBS. However, it's important to remember that these triggers don't always lead to GBS. Most individuals exposed to these triggers never develop GBS, suggesting that genetic predisposition might play a role. Further research is needed to fully understand the complex interplay of factors that contribute to GBS. Recognizing the early signs of GBS is crucial for prompt medical attention. Early detection can significantly impact the course of the disease. The first symptoms are often tingling and weakness, usually starting in the hands and feet. This sensation can worsen over time. These sensations may spread rapidly, reaching the arms and legs. The speed at which symptoms progress can vary. As the condition progresses, muscle weakness intensifies, leading to difficulty walking, speaking, and even breathing. Thank you so much for watching. If you found this video helpful and want to keep learning with us, please don't forget to like this video and subscribe to MediHead for more detailed and easy-to-understand medical content. Hit the notification bell so you never miss an update. Your support helps us create more educational videos for future doctors like you. See you in the next one.